Welcome back on the AM show. We talk health now. Even in Ghana, childhood cancers are becoming ever more prevalent. We're seeing many of our children, some of them at Kolibu in different parts, some with the assistance of others are able to receive the health care they need. But there are a lot of them who don't even report these cases because of the cost involved. And sometimes because they wait for so long, parents among others, so that by the time the cancer is detected, it's almost terminal. But no child has to go down that road, which is why we have Dr. Tanya Trippett in the studio with us this morning. She's a pediatric oncologist and she is president of Wish4life Foundation. They are focusing on some of these matters to bring relief to some of these children. Dr. Trippett, good morning.
Good morning.
Thank you for joining us on the AM show.
Thank you for having me.
How did all of this start?
So actually this started from a child. It was a wish from a patient of mine in New York City. He was a young man that lived in Africa, in Rwanda, and was diagnosed with cancer. And 1 month into his treatment, he said to me, instead of having a Make-A-Wish, which we offer our children, he wanted the wish for me to travel to Africa to make sure the children in Africa were receiving the same kind of cancer care that he was receiving in the United States. Hence the name of the foundation, Wish4life.
Wish4life.
Yes.
And so how long has this foundation been active?
So it's been active since 2013 in the United States and throughout, and we are going strong to date.
In terms of Ghana, how long have you been here and what exactly have you been up to? You've come here before and shared stories with us of what you've done so far, but how long have you been in Ghana and what have you been up to?
So we joined the community in Ghana in 2017, and we began to look at ways to partner together to look at building an international children's cancer center here. And we started with working with the government authorities, looking at the feasibility of building the hospital here. So we have a site in Asikam now that's 22 hectares in size. And we'll actually situate the hospital in a portion of the country where many of the children don't have access to cancer care. They don't come to Accra for care. So there's a great need. The second thing that we've begun to do is once we build the hospital, we know we need to have an operational staff that's used to practicing cancer care as we do in the United States and in Europe. And why that's important is our cure rates are 80 to 85% of children now are cured of their cancer.
Wow.
When we look at the numbers in Ghana, they're 25%. In other countries in Africa, it's much less. And so we want to fill in that gap and bridge that gap. So we've conducted educational courses in cancer genomics and also in clinical trial development here in the country through the University of Ghana Medical Center and through Noguchi Memorial Institute for Medical Research. So we've been partnering with those institutions to have educational programs. We're also helping on a food program at Sunshine House, the house that was built by the First Lady for outpatient families at Kolibu, and we've been fighting that's been a wonderful, enriching experience by providing meals for the children there in the house. So this is a little bit about what we've been doing.
Let's dive right into the hospital project because I'm looking at the figures here, the budgeted amount, and these are huge. But of course, you cannot put any monetary tag on a human life. Not even one human life can be valued in monetary terms. But walk us through what it will take to put up this edifice. I'm looking at the figure, but I wanted to come from your own mouth.
So remember that figure is for an entire complex.
Okay.
It's a cancer center complex. The hospital itself it will be about 170 million.
174 from what I have here.
Yes.
But the total expense, 261 million.
Yes, so the total expense will include equipment, the state-of-the-art equipment, but also housing and residential facilities for the patients and their families, and also for the medical staff. And then for the groundwork surrounding and supporting the hospital, as well as the information technology system, security, energy, and also there's a chapel on the site.
So I see here the hospital, external works, family housing, staff housing. Of course, some families will have to come and stay with the patients.
Yes.
because that will be required. The chapel medical equipment alone valued at $40 million.
That's right.
And the site is become 20 hectares donated in cooperation with the Ochehene Osajefo Nana Amwetia Oforipening II and the Achim Ibuakwa community. Interesting sighting there. But looking at this cost, how are you raising these funds?
So we're doing it in a number of ways. One is the community campaign, which we'll talk about in just a second, which is the Voices for Life campaign, which is rolling out as a global campaign to support the building of the cancer center and also the operational side. And then we have 7 revenue streams that we've been looking at from many different demographics throughout the globe, multinational funding, also high net individuals and corporations, religious community, a variety of communities that we're tapping in for support. And we've been very lucky that we have a number of sponsors that are working with us. We're providing in-kind donations. So that dollar tag goes down each time they provide a service or a portion of the needs of the hospital. And so this is how we're dealing with the cost.
And I see here your strategy where you have those mentioned groups, high net individuals, US-based funding institutions, multinational funding agencies, corporations and foundations, and the Ghana government administration. I see the 20. Is that 20 million?
So we're looking at just a 20 million fragment, which we hope to be able to support through businesses here as a part of their gift to the community. It will also incorporate the community fund. And the purpose behind the community engagement is it speaks to the rest of the world that children's lives are important. And so the community is making investment in it, but we don't expect for them to take that ticket cost of $250 million. We'll do that through the rest of the world in terms of working with people who are like-minded like us.
And I must say it's an amazing project that you've taken up, especially anything targeting children. I'm very fond of children, and especially with the situation in our part of the world and everything, vis-a-vis what you find in your part of the world. It's very heartwarming. But for those who are watching us this morning, those CEOs, heads of businesses, small, medium scale, big, people of goodwill, how can they, if they wanted to contribute to this project, how can they go about it?
Okay, there's a number of ways. We encourage our business partners to give not just their dollars, but to show their heart commitment. And so what we mean by heart commitment is leveraging a strong part of our ethos of our foundation, which is called intellectual philanthropy. Most times persons get nervous about giving $1 million to $20 million or what have you, but they don't realize another gift that they can give is their wealth of knowledge in the space in which they practice. So we have attorneys that are donating their legal services for free. We have persons, for example, Electa is a developer or manufacturer of radiation equipment. They help to custom design the radiation suite for this hospital for free.
Wow.
So they spent 2 years during COVID with us on Zoom, custom designing the the radiation therapy suite. If we captured those dollars, it would be millions of dollars of intellectual support. We're going to need that for the operational side of the hospital, not just for the construction. So persons that have business savvy, we want to make the hospital sustainable, that we cut costs but maintain quality. And persons that run businesses have a good sense of how do we make sustainable, resilient businesses. And this is what we would like to see. The novelty that we're bringing into country can be leveraged as a social enterprise. So what we mean by that is that it can be a for-profit entity that helps a nonprofit by the revenue that they generate. A portion goes to the hospital to maintain it. So some of the areas that we give an example is for the isotopes that will be made inside of the hospital in the isotope facility. That can become a business, but it's not going to be a business that's run by me from the United States or a U.S. partner. It's actually going to be built by persons from here. So
I see.
It will become a business.
So the technological transfer,
right.
the transfer of know-how.
That's right. That's right. So we have specialists that work in that area at my hospital and Sloan Kettering who are transferring that knowledge. So now they're working in concert with the Ghana Atomic Energy Commission and the Nuclear Regulatory Authority to begin to shape that type of cooperative venture. So what it does is it helps the hospitals in the region to have new modalities of treatment, which we're bringing in PET imaging, which is really crucial for cancer care. And we'll provide the isotope for the region. So that generates revenue that then
And speaking of the region, I mean, the Kolebu Teaching Hospital, premier hospital in the country, if you like, the University of Ghana Medical School, they become centers of health tourism, so to speak. People from the sub-region come here. You say this is going to be an international cancer center. This also implies, from what you're saying, that the sub-region will benefit. Other countries that don't have facilities like this will have their people come in, and that will also be beneficial to Ghana.
Yes, that's correct. So we've already begun to hear from doctors in Nigeria that would like to send their pediatric patients here. And so we'll open the doors to the ECOWAS nations and beyond for the children to be able to be treated at the hospital.
All right. So to cap off the conversation, and then right before I allow you to reach out one more time to all of those watching us, has the project taken off in any shape or form yet? You're still soliciting funds, but what is on the ground as of now?
Okay, so what's on the ground right now? We've completed the title transfer. Our team is on the ground. We've completed the topographical survey of the site, and now we're moving into the full stage towards construction, which is the enabling works. So we're ready to fence off the property and clear, and then we'll move, we hope, at the end of the first quarter into the stages of the initial stages of construction. Our plan is a 2-year build, and we'll look at
2 years.
2 years, yes.
Okay.
And so the plan is from 2024 to 2026.
All right. Finally, what has been your engagement with? I saw the code being put up. What has been your engagement with the health ministry? Have you had any interactions with the president, for example?
Yes,
like,
exactly.
what has the interactivity been like?
So we've been very, very fortunate. From the first day that we arrived in Ghana, we were welcomed by the president, Nana Akufo-Addo. I was very fortunate to meet him, and he's opened his doors for me to meet with him and give him updates, so I really thank him for that. We have had engagement with the Ministry of Health, particularly the Oncology Division. They've been very informative, and they've been very helpful with the steps that we have to follow to meet regulations in country. Also, we've spoken to HEFRA and the Ghana College of Physicians and Surgeons, and a variety of agencies who have helped to guide us so that when we build, we're building with respect for the community, respect for the regulations, but also making sure that we keep the quality very high.
Well, Dr. Trippett, we can only wish you the best in all of this, as we wish ourselves the best, because we're all going to benefit from this. No child should have to suffer that. Dr. Tanya Trippett is a pediatric oncologist and president of Wish4life Foundation. And of course, as you can see at the bottom of your screen, that is the code to which you can donate, *718 *25 *958#. That is it. And then we also have the account numbers. Wish4life Foundation, that is Stanbic Bank, Spintex branch. The current account number 90-400 111 66886. The USD account is 90-400 111 67211. And the SWIFT code is at the bottom as well. Of course, you would need that for certain levels of transactions. SBIC, that is Stanbic, SBIC, GHAC. Let's all donate. This is for us, by us, hopefully. Dr. Trippett, one more time, thank you for coming.
Thank you so much.
Well, we veer into our next conversation now. We're going to be talking about the ECOWAS system, legally speaking, and what we can expect. Well, there is a lecture series, the latest of which will be held tomorrow on the Gimpa campus. That conversation up next on the AM show. Do stay.